Hey everybody, it's Dr. Eric Balcavage, and we're back for another edition of the Thyroid Answers podcast. This is episode 33, and we have Dr. Kelly Halderman with us, and of course, my partner in crime, Dr. Erica Riggleman. So,
Hi.
Dr. Kelly, Dr. Erica, good to see you guys on a beautiful Friday morning, right? It's beautiful in my dungeon basement, but I'm getting ready to head to the beach shortly as soon as we get this finished. So, Kelly, we are thrilled to have you come and educate us a little bit and our listeners or viewers on detoxification, especially phase 2.5, which is something that you've been talking about quite a bit lately. But before we kind of get into the detoxification thing and have you explain a whole bunch, all this stuff, why don't you give the listeners a little bit about your background? Because you have an interesting background to get you from where you were to here, right?
Yeah, definitely. So thanks for having me, Dr. Eric, Dr. Erica. So I started off in traditional medicine, was practicing bread and butter family practice. When I myself got sick out of the blue, I started having migraines and foot drop and paresthesias and just really strange symptoms. And I was eventually told I had MS. And my colleagues told me that basically I should go home and get my affairs in order and spend time with my family. And that just didn't work for me. I knew that in medicine we were doing a lot of amazing things, but when it came to finding a root cause, we weren't very good at that. So I had to take a step back and went and earned a naturopathic medical degree and used those principles and philosophies that I had really never used before, such as nutrition, to help claw myself out of that deep trench of disease. And I'm 110% better. We actually had our third child after going through the all that, that critical diagnosis, and he's happy and healthy. I was eventually diagnosed with Lyme. That's what my root cause was. So getting to that and really learning about how to treat my body, treat the terrain, and then also, cleaning up that pathogen was really my journey and how I got into functional medicine myself.
Awesome.
That's an awesome journey, because sometimes it takes you actually getting sick before you open your eyes to see what's really going on. And sometimes that's the sad reality, is that you have to become sick to start digging deep for your own personal health. I know I kind of had done the same thing, and I'd also been diagnosed with Lyme and gone through that whole route itself. So it's one of those things that sometimes you have to be sick to open your eyes to even go down that path, which can be a blessing often.
Absolutely.
So I'm going to ask a question. This is a little maybe off topic, but I'm going to ask both of you to get the question. I want to get your take on it. And I know I've had a discussion with each of you guys separately, but I think it'd be good for the listeners. We discussed, both of you guys had Lyme, right? Mold toxicity is a hot thing right now. Now we're talking about retroviruses, right? So Kelly, you said something I think is really important, because there are people who have Lyme, right? And it contributes to their illness. There are a whole bunch of people testing with high Lyme titers who are perfectly healthy, have no problems, right? So can you each just give your opinion on whether, when we're talking about Lyme or mold or retroviruses, is it a thing that's creating the illness or disease? Is it the load, or is it in the environment, or is it really a combination of all those things? Do you understand what I'm saying?
Yeah, and I would agree that it's actually more of the load and the environment put together. So we're looking at, it wasn't one thing that got me a diagnosis of MS. It was, obviously the pathogen. There were many things. I was a vegan diet, which just wasn't working for me. And it was setting up my terrain that I was like a delicate flower. I couldn't handle anything. And, my husband, who, is a weightlifter and rock solid, he probably has Lyme just the same as I. So I believe that we should live in symbiosis. If our terrain is set well, we can live in symbiosis with a lot of the factors in our environment, but we have to get that right, and our environment's getting worse.
And I agree with the same concept. I never tested positive on a lab test for Lyme, but through some muscle testing and some kinesiology, I tested positive for that. But I have no idea when I actually maybe even came in contact. I may have had it from very young. I mean, I lived in Michigan, living out in the, always cutting wood and bringing wood in and being outdoors. I mean, I could have had it as childhood. Where I really saw the things change is when I was going through chiropractic school. I was stressed. My diet was terrible. I was not eating good. I didn't realize that gluten and dairy were bad for me. And so I think that it was that environment that maybe allowed that to flourish and create more issues. And really that's what kind of created this whole cascade. And for me, in my case, and I think that that's for most patients, it's not just one little thing. It's the kind of the perfect storm that happens.
And so I'm glad you guys point that out, because we get so many patients, and I know you guys get it too, where I have Lyme, they get treated for that, and then they're still not healthy. And so then somebody treats them for mold and they're still not healthy. And so they find out, okay, it's SIBO. And so then they get treated for SIBO, and that doesn't, and they're still sick, and they're chasing the one thing, instead of getting back to basics and the foundation and the terrain, right? The environment's healthy. We take a look at people that have, like, herpes is a great example, right? You have that herpes virus that's kind of hanging out all the time, but it may never bug you until when? Stress. And then all of a sudden, bang, you got this thing that's, this mountain that's on your lip, and you go, oh, but that should tell us that we were living, for the most part, in harmony with that virus, right? And as the stress load got extended, we put more stress on the cellular system. We see these things create more of an effect, right? But it's not necessarily those things all the time that are the primary thing. It's the load, it's the change in the terrain in the environment. And then we see these things. And even things like MS, like, that's just a name we came up with, right? And
the finding, yep.
Right. We say, oh, it's MS. Well, no, that's what we've labeled it. The MS isn't actually the problem. The problem is what caused that symptomatology, those signs, right? Mm-hmm. So I'm sorry, Kelly, I got way off target, but I thought it was important just to kind of get through that.
No, I think that's really important for people to understand. They're always searching for that one thing, and it's often never the one thing. It's a combination of a whole bunch of things. But if you don't take a step back and get the big picture, you're really going to miss. You can't just put your little blinders on and go from one thing to the next. You have to kind of take it as a big approach.
Yeah, 30,000 foot view first, right? Yeah. So that brings me to the next big point, and that is that on here, we really talk about cellular hypothyroidism as kind of a root issue. And so many people are told they don't have a thyroid problem because their TSH is still normal and the gland's still functioning. And we argue all the time that hypothyroidism, the reason you have symptoms is because you don't have sufficient thyroid hormone at your cells, period, right? So if you could have a gland that's totally gone, right, and put enough thyroid hormone in the system, and if it gets to the cells, you'll be fine. But the problem is that if it gets deactivated at the cell, then you don't have sufficient thyroid hormone, and now we have this state of cellular hypothyroidism that drives the kind of this cascade of symptoms, which we then kind of try and manage and treat with medications. But in reality, they have this cellular hypothyroidism going on, and it eventually drives into that autoimmune process, primary hypothyroid issue. But so do you agree with that philosophy?
Oh, absolutely. Absolutely. I myself, when I had chronic Lyme, I was in the cell danger response. I was stuck. I had a high reverse T3, and it wasn't about shoving more medication into my body. It wasn't about forcing that sick cell to respond. It was about correcting the overall, the backing way up and looking not at the downstream effect like we do a lot of the times in both allopathic medicine and functional medicine. We're trying to fix things that our body has done inherently to help us.
Mm-hmm.
So can you talk, because you mentioned it, the cell danger response and the cellular hypothyroidism. I think Dr. Erica and I are on the same page. I'm sure you are as well, that the thyroid deactivation, right, is not abnormal. And it's actually part of this thing called the cell danger response that Dr. Erica and I have talked about many times. Can you kind of explain the cell danger response and why it may be beneficial for the cellular system to deactivate thyroid hormone?
Sure. So our body's really, really smart. So what it will do is that if it senses stress, the mitochondria will will sense that decrease in electron flow. And that stress can be from a biotoxin, it can be from emotional or physical stress. And that the body goes into a siege mentality where it starts to shut things down to try and help us, to try and help the host. And one of those downstream effects is that it will start to downregulate the thyroid metabolism. So we'll have less of the thyroid acting properly, or I wouldn't say properly, I would just say it's trying to slow that down to help protect us. And so again, when we're looking as practitioners and saying, oh, your thyroid isn't working properly, we're really missing the point. We're missing the point that our body, really that cell danger response by Dr. Navio, one of the 8 downstream effects is they're protective. And that's the paradigm shift that I learned about. I was blessed to learn about that.
So one of those key things is that if you have stressors, and we're going to talk about those things like physical, chemical, emotional, or microbial stress, especially impacting the cell, it drops the energy level of the cell, and the cell senses this drop in energy and it takes that as a threat. And then part of that process is then to slow down the metabolism of the cell, because if you speed up the metabolism of a sick cell, you just get more sick cells produced, and more sick cells is what we call cancer, right? And so if there's an organism, a bacteria that's inside the cell, one of the last things we want to do is bring more food, bring more fuel into the cell to feed that organism, right? To keep it thriving. And this part of that cell danger response is to deactivate thyroid hormone, slow cell metabolism down, decrease glucose transport into the cell, which makes you insulin resistant, but reduces the carbohydrate load for those organisms so they can't thrive, and stimulates a thing called autophagy, so the cell starts cleaning up itself. So it's really not a mistake. It's really part of the healthy sick response, right, of the cell to try and help really protect us. We just have a problem that we want to blow past that, right? We want to say, we'll just plow more thyroid hormone in there and that'll fix it. So one of the things that we want to talk about is that the stress, these toxins, these pathogens are the things that can drive this cell danger response. And part of what we do in functional medicine, more than maybe traditional medicine, is we say, hey, we have to detox the body. We need to get these things out of there, right? And so there are phases of detox that most people have heard of. But what we'd like you to do is talk about those kind of main phases of detox that most people might have some understanding of, and then kind of discuss what you've been talking about quite a bit lately, and that's phase 2.5, which most people probably haven't heard of yet.
Sure, yeah. So the normal phases of detox, phase 1, 2, and 3, those are pretty much well known. So just to review, the phases of detox, the goal is to basically take endogenous products such as hormones, and then exogenous things such as drugs and toxins, and package them up so that they're water soluble, so that they can exit through the urine or through the bile to the intestine, to the toilet. That's the whole goal. So, and I think of phase 1, 2, and 3 as activate, conjugate, and then excrete. That's just very simple. So phase 1, we have oxidation, hydrolysis, reduction. We need nutrients. We need B vitamins. We need a lot of flavonoids. And then that will make the compound a little bit more reactive and not ready, not yet water soluble. And that's where phase 2 comes in. And phase 2 will transform those endogenous or exogenous substances so that they are water soluble. And that involves glutathione conjugation, sulfation, acetylation, glucuronidation. We need a lot of great nutrients that are high in sulfur, for instance, glutathione, cysteine. We need magnesium. We need our B vitamins. Folate and folate. So then we have a nice water-soluble molecule that is excreted through the MRP2 channels that goes out into the bile caniculus. So you have your nicely packaged water-soluble toxin. It's exiting through that membrane that connects the hepatocyte and the bile caniculi, and it goes through there. And that movement is coupled with the flow of bile salts and also phosphatidylcholine. So all 3 of those have to happen in tandem in order to get that water-soluble compound into the bile. Once it's into the bile or into the urinary system, it will be excreted. Now, phase 3 is that excretion process. I think of phase 3 being most important, obviously, in our gut, because in our gut, we have a big responsibility to make sure that nicely packaged toxin that's laden with bile gets into the toilet. And that's where I think a lot of practitioners, we forget that, phase 3, what we can have is reabsorption when it's not working well. So those toxins can go right back into our bloodstream when they're not bound well. That's why I'm a big believer in using binders. That's like our insurance policy to help get that toxin out and for excretion. So then comes in that 2.5. Well, what is that? So I was looking at a lot of my patients that had SIBO, and SIBO in my practice was the revolving door. And I'll just be honest with you, is that I felt like it was a losing battle sometimes, and I felt really bad for my patients. So I took my background, my undergrad in biochemistry, my medical degree, my naturopathic medical degree, and more recently my genetic training to take a second look at what is going on. And what I found is I found problems in those patients with making phosphatidylcholine and perhaps making the bile salts. And remember, we talked about it's a 3-part process to get the phase 2 toxin out into that bile caniculi. So if you have problems with that movement through the MRP2 channel, if that's not working, then we should come up with a whole new name for that so that doctors respect that. And that's where I'm like, let's just call it 2.5. And that if we can hone in on 2.5, what it is, so 3 things: the toxin through the MRP2 channel, the bile salts are made and excreted, and then the phosphatidylcholine, which makes the bile nice and not viscous, not sludgy. You hear a lot of, I have gallbladder sludging, cholestasis. Well, that can be a phosphatidylcholine issue. So getting that out into the system to get it into the toilet, that's that 3.5. Sorry, 2.5. There's not a 3.5 yet. Maybe there will be a 3.5.
So what you're saying is that biliary function and liver function are extremely important for helping to move that through. I think a lot of people forget the whole digestive part of it, and they just want to go right to the detox part of it. And I think there's a whole bunch of things that have to be done prior to even getting there to make it safe and effective. Because if not, you may not even get it at all. But then if you don't do it properly, you may just reabsorb them.
Right. What's happening to me when I had chronic Lyme, and this is kind of how I figured this out too, is that well-meaning practitioners were putting me on phase 1 and phase 2 pushers. But my phase 2.5 was broken. So what was happening is that if I couldn't get those toxins out that were being mass produced because I was put on a lot of glutathione, let's say, they were going back into my bloodstream. And that's what I think of as a Herx reaction, is that we're auto-intoxicating instead of getting the toxins out.
Mm-hmm.
Yeah. And so I guess from a short summary, you might need to support all 3 phases, all 3.5 phases, right? But your body should do these things naturally, but because of the stress and the allostatic load we put ourselves under, these processes can get compromised a bit. So one of those things that I think is important is if we take a look at this whole detoxification process, and if we have a person who's trying to just do the detox of the week that they read on the web, right? They can really create some issues, as Dr. Kelly said, because you're liberating a bunch of toxins that you may not be able to get out of the system, and now you've got these free-floating toxins in the system, which can make you sick, make you not feel so well. It can really create some compromise of your overall physiology. So in an effort to try and do something better for yourself, you may actually be making yourself worse.
That's
right?
Mm-hmm.
So from a support standpoint, I just want to kind of get a general idea for people when they're thinking about these phases of detox. If they're trying to support these phases of detox, where do they start? I mean, what are the kind of some of the things they can do to support the process?
Sure. So, basically we want to kind of take a step back and look at the function of bile. So if the function of bile is to emulsify and digest fat, So, you can look at making sure your digestive system, make sure you're chewing, make sure your stomach acid is appropriate. And you can do some trial and error, or you can use a skilled practitioner to really help sort that out for you. I'm a big fan of using digestive enzymes as well, just to have your food really, really absorbable. And then, looking at the bile as it regulates glucose and cholesterol metabolism, looking at how it helps impact the thyroid hormone activation and also the gut motility. So optimizing that bile, it really comes down to optimizing the phase 2.5. And phase 2.5 is shut down by inflammation. So taking a step back and looking at the body isn't good at quenching inflammation and doing detoxification. So working on your environment that's probably pushing and driving the inflammation. So clean air, clean water, eating really well so that you're not putting more fuel for the fire is really an important piece. Stress management. So I used to kind of poo-poo stress management, like, oh, I'm not stressed, and until it was like a looming piece over my head that I really needed to deal with. And it's really when I took that seriously, when I started really trying to calm that down, because it'll set off your masters of inflammation or your mast cells, and they degranulate when we get cut off in traffic. If that made you mad, that makes me mad. So really looking at the overall picture and how we stabilized 2.5, a big piece is just foundational things, just really foundational things.
I think going to you, speaking of mast cells, just like the thyroid, a lot of people think that mast cell activation, they think of it as a really bad thing. I think it's a normal part of the body that's trying to tell you something, and then you need to say, okay, why are those being activated? A lot of the patients who come in who have mast cell activation are just like, how do I suppress it? How do I suppress it? And that, that may temporarily make you feel better, but there's a reason why that's happening, just like if your body's trying to shut down the thyroid mechanism.
Right on. Mm-hmm.
So since Erica, since you brought that up, let's kind of touch on that a little bit with how the mast cell piece, if that's all right, Kelly. Mm-hmm. So we talk about bile physiology. We know that stomach acid is important to stimulate bile physiology. We need things like phosphatidylcholine to help with the function. We need to keep our inflammatory load down to have good bile production and excretion out of the liver so they can get to the gallbladder so it can be ready. What's the role of bile in the small intestine? What does it really do in the small intestine, and why is it so important to keep bacteria under control and to limit that excessive histamine response?
Sure. So bile is this sludgy gift from God, acidic in that pathogens, it really keeps the pathogens at bay, and it really helps the commensal bacteria be really healthy. So it's all about, again, it comes down to your terrain. So if your bile is not flowing, I think that it's a critical piece in why we're seeing that SIBO revolving door, because the gold, the magic gold, is not flowing in there. So bile consists 95% of water, 5% of the bile salts and other inorganic and organic substances. It's normally supposed to flow through and then be reabsorbed. So there's a reabsorption piece. And when it's not being reabsorbed properly, let's say if you have leaky gut or other issues, you're just creating lots of problems downstream. And then sometimes, we use things like ox bile or TUDCA, and that can be a nice Band-Aid to help throw in some more bile salts. But really, Eric, you taught me this about how your blood can only handle so much bile salts, and when you're overdoing it, when you have too many in there, it can actually shut down the TGR5, I believe, which can end up with more conversion of T4 to T3. You can end up a little hyperthyroid, eventually hypo. So I actually had that happen myself. I don't have a gallbladder. I overdid it when I was using the ox bile, and my labs were just all over the place. So what I did is I fixed my body's own mechanics. I made sure that my bile, and this is dynamic, we don't fix it and then we're done. We live in an environment where we have to keep supporting everything. So fixing that was really important. I also, so kind of going back to the histamine issue. So the bile, if your gut is full of histamine and you're taking in histamine foods and your histamine load on your body is really high, it's going to actually take away, in simplistic terms, your body's ability to make bile, because the building block for that bile acid is actually going to be shunted or stolen. I call it the acetyl-CoA steal, in order to quench all the histamine, mop it up. And also that acetyl-CoA is supposed to go down to make ATP. I mean, our sickest patients, or, maybe even the majority of the population these days, are tired. We're tired. And when the mast cell degranulates from several things, everything from Lyme and heavy metals and stress, it will actually put out, one of its mediators is histamine, and that histamine needs to be taken care of. It needs to go through and be able to be excreted. And so it's going to use the building block for bile to mop up the histamine. I thought that was really a huge clinical pearl. Why we really need to be aggressive in fixing the gut, making sure that we're, supporting the histamine, supporting the degradation of histamine.
So we have, if we look at bile and we kind of put those pieces together, we've got this bile product that needs to be made appropriately. It needs to be released appropriately. It needs to be excreted into the small intestine appropriately. And we can touch about why maybe estrogen plays a role there in a second. We can ask that. But the bile in the upper intestine has an antimicrobial role, right? It helps break down the bacteria in the upper GI tract, and that small intestine is designed to be really kind of free of a lot of bacteria. And so if you lose your bile function in the upper part of the GI tract, you lose the ability to keep the bacteria in check, and that can be one of those factors that drives SIBO, right? That drives that bacterial overgrowth, that can create some inappropriate fermentation and gas and histamine production. And then that bile in the lower end of the GI tract also plays a role in indirectly as an antimicrobial, because as it's absorbed, it can actually stimulate the release of antimicrobial products to go in and kind of keep that bacteria in check. And it does play a role in leaky gut, right? So that if you don't absorb appropriate levels of bile, you have this sensation of leaky gut. There's these junctions that maintain the integrity of the small bowel, and without the appropriate bile amount being absorbed, you lose those tight junctions, and now we have this chronic leaky gut that so many of us are being treated for, and have all these food sensitivities and food intolerances. And the food sensitivities, the food intolerances, the bacteria, and the histamine overload, these things aren't like different things. They're all really big pieces of the same puzzle, correct?
Right. Mm-hmm.
Erica, any add on to that?
No, this whole thing is people try to decide whether it's the chicken or the egg, which one ever came first. And I think it comes down to it's kind of all coming together. If you have sluggish bile and then you're not eating the correct foods and you have a little bit of a leaky gut, you promote more of the bacteria, and then the more you have bacteria, it stresses the body, which slows that down. And it kind of becomes this vicious cycle that, you kind of have to take that big picture, not just trying to up the herbs or the antibiotics or the antifungals, all the things that people get put on. I think sometimes you have to take a step back and look at some of the simple things, like, are you able to digest your food? Are you even making bile? All those things that are foundational.
So if we have a patient who's got a bile gallbladder issue, what are some of those key symptoms that they may want to say, wow, that I have those. That may mean I have a problem with this bile physiology, this 2.5 in this detox phase. What would you say some of those symptoms are that they might experience?
Sure. So if after eating a meal high in fat, they feel uncomfortable, they have, gas and bloating, and just maybe right upper quadrant pain, that they're seeing their stools float or they look greasy. Those can be some tip-offs to that. Do you have anything to add?
I think those are good points. I think one of those things is definitely if they have gas or bloating, and that's kind of occurring, that half hour to hour and a half time frame after a meal, I think you really got to take a look at what's happening in that, from the small bowel, the gallbladder, digestive enzyme secretions.
And I also see a lot of patients who have gallbladder issues have shoulder pain. So some of their pain can actually be referred to their shoulder too.
Yeah, great point there. So if you have this chronic right upper shoulder pain that you keep going to the chiropractor or the physical therapist to get adjusted or treated, it never seems to go away. Yeah, you got to start thinking gallbladder. And even if you have chronic reflux stuff going on, you have to consider the fact that maybe that's part of the piece as well, because all of that stuff can reflux up out of the small intestine into the stomach and create a host of issues.
Mm-hmm.
There was another piece I wanted to add to that. I know what it was. Right now, there's a big movement from our SAD diet to this ketogenic diet, right? High fat diet. What challenges do you see from patients or what might they experience as they go from this kind of standard American diet to the kind of hot ketogenic diet? What challenges might they experience if they have this problem with 2.5 in gallbladder function?
Sure. So, I myself went on the ketogenic high fat diet and couldn't figure out why it wasn't working for me. It seems to be working for everybody on the internet and on Facebook. So I don't have a gallbladder. So putting in that high amount of fat just did not work for me. I had more downstream problems than I did, positive ones. And Eric, you and I were talking about this, how, if we're putting in a large amount of fat and then our minerals are needed to help digest and really deal with that load, that we're going to have some freeing of perhaps oxalates. And a lot of the foods that we think are really healthy can be high in oxalates, such as kale. And it can just really spur on more problems. Leaky gut. And I will say that endotoxin, that lipopolysaccharide, that will actually shut down phase 2.5. So we can kind of get in a tailspin. And that's why I don't like, diet recommendations that just cover the masses. Like everyone has to be X, everyone has to be Y or Z. Really look at the person and see, what they have going on, and not everything can be helpful for everyone.
So part of that, and we were talking about that offline, and that, we see these people do ketogenic diet, and I'm not opposed to it. I think intermittent fasting and being more ketogenically based versus, high carb is probably a better way to go. But if you put those things in and you get the symptoms like Dr. Kelly was talking about, the gas, the bloating, the pressure, loose stools, you probably have to address your gallbladder issue. And because on the other side, you're eating these nice, healthy vegetables that have some oxalates contained to them that shouldn't really ever create much of an issue. But if you put the fats in, you can't absorb them because of poor bile and gallbladder function. Then the minerals bind to the fats so they can go out in the stool, which is what Dr. Kelly was referring to. And now we've got mineral deficiencies. We're not absorbing the minerals we need. And now we've got these free-floating oxalates that, because of our bile gallbladder issue, can now leak into the GI tract much easier. We got free-floating oxalates into the system, which create arthritic conditions, stones, all kinds of brain fog, fatigue, all kinds of issues, right? And then they bind up with heavy metals and minerals in the body. And so again, we're creating more issues. So I think that dietary choice is good, but if you start to switch to that ketogenic diet, you're really struggling with how you feel. You have to consider the fact that you got to get your gallbladder and bile physiology looked into a bit.
Right.
Dr. Erica, I know you are the keto queen. So is there any points you want to add to that?
No, I think it's you go back to each person as individual. And I definitely, if somebody doesn't have a gallbladder, you want to take that into consideration, especially, I've had patients come back in who have, jumped going from a high carb processed diet to I'm going to be keto 100%. And they end up and they have a lot of digestive distress from doing that, and can be quite a story if they consumed a large amount of fats and their body wasn't able to deal with that. So yeah, you want to take it slow, and you want to find out what diet actually works best for what's you've got going on. And that can change, from time to time. As you get healthier, you may be able to tolerate more of a ketogenic diet later on, but it really depends on the state of the body at that time.
Right. So if we had to leave our listeners with some key things to do to kind of support detoxification more from a natural perspective, we don't necessarily want to say, okay, take all these supplements to do that. But from a dietary and natural detox perspective, is there 4 or 5 foods or recommendations that you would make to say, hey, do these things, because this will support detoxification in a more natural process? And if they don't work, then you definitely need to reach out to a functional medicine practitioner who's got some skill set to help you with it. But what would those things be?
Sure. So I really like to think pretty simple in that we have to first deal with our environment, because our environment is really setting off the inflammation, which is shutting down so many things in our body and making it the ability to detox almost impossible and dangerous. So I like to start with, a clean diet. And I know we always go back to that, but if you don't have a clean diet, there's not a pill or medication on earth that's going to help you. So, making sure that, you're putting in really good foods into your body and that they're appropriate for you. Don't just listen to your neighbor Joe who's telling you to go on the high fat diet. Just really take into account how you feel is the, your N of one, we say in medicine, is that how you feel when a food is put in your body is usually typically a good way to kind of gauge out what can be helpful or harmful. I mean, we do a lot of food testing as well, but it's somewhere to start. If you eat gluten and then, you get headaches, I mean, that's a big red flag. That's something that I hear over and over. I eat gluten, but it's okay. I just get a little headache. And it's just like, take a step back and look at that. And then, clean water is really important. In my house, we just moved from Minnesota to Florida. And one of the first things we did is make sure that our family's drinking clean water. So lessening the toxin burden, and that has to do with food as well. And then stress management. I really took this for granted, but then when I started managing my stress, I'm like, wow, I feel so much better. And I really, a lot of the supplementation that I was taking, I don't need it anymore. So I really think we can't supplement ourselves to health. We really have to look at foundations. And then sleep, of course. Sleep is so paramount. So do what you can. Always think about your sleep. I really focus on sleep with my patients all the time, and that what are we doing where we can support this? Make sure we're protecting ourselves from the blue light from our screens at after dusk is extremely important. That's where we start with helping people in functional medicine or these things. And then I would say, phosphatidylcholine is really important. So I am blessed to be able to eat eggs again. And so I can get my phosphatidylcholine from that, as well as liver. Who's a big fan of eating liver? I don't think there's a whole lot of people who would say they love it, but liver has been really important for my family and I, in that it has the bioavailable copper that we're lacking in our diet. And it also has the B vitamins that are naturally occurring. I'm really there. They make desiccated grass-fed liver capsules for those of us who don't like to eat liver, but that really helped. And I actually have all the genetic mutations that make me a person who would not do phase 2.5 well. So that has helped. And at one time I did have to take phosphatidylcholine, and that was okay. If you have to use Band-Aids, that's okay. But really looking at that. And then I would say pantethine. Pantethine is one of the few things that I do take, and that's to support the production of acetyl-CoA. So if you're a science and pathway geek like us three, you can look up the electron transport chain. You can Google acetyl-CoA and find out all its functions. And see why pantethine is needed to make the CoA. And panthethine's pretty low risk, but you may want to check with your practitioner, but it's something that we found lately to be pretty helpful.
Erica, anything you want to add to those things?
No, I think those are great foundational things. I mean, we harp on them just about every single podcast. Because they're so important, we don't just say them over and over to be repetitive. They're truly are the foundational stuff, and a lot of them are free. That's the great thing about it. You can, working on your diet is free. Working on stress is free. People come to me and they don't want to spend all this money on supplements, and let's work on the things that are free. Let's look at your environment. Let's do all those things. It requires effort, yes, but a lot of them are free. So those are some great foundational things I think that every person could always improve on. Even if you're healthy already, we can always improve on those foundationals.
And I'll add two things that I think we can simply add that are pretty easy to do. And one of those is, and it's one thing I spent a lot of time researching over the last 2 years, and that is something called sulforaphane, which is in broccoli sprouts. Super stimulator of the detoxification pathways, and something called your NRF2 pathway, so your antioxidant pathway. Huge. And so it's a food, right? So you can grow broccoli sprouts in your kitchen and consume those on a daily basis, and you've got a great food product, and that's got a whole bunch of other cool stuff in it, right? That helps support detoxification pathways, estrogen clearance. So broccoli sprouts, grow them, eat them. I mean, I think they taste good. Most people, once they kind of get used to it, find that they taste really good. And then from a supplemental standpoint, one of those things that I think all of us would agree is a big challenge is minerals, right? Is that we're eating food that's devoid or deficient in mineral load. And so things like trace minerals from, consume more sea salts or things like that have trace minerals. You can buy them, but you can also get them from just using good quality sea salts. I use Redmond's sea salt as a regular staple. And then the other thing is magnesium deficiency is a bigger issue than most of us realize. And you could do things really simply to support and inexpensively to support magnesium. You could do Epsom salt foot soaks, right? You can make your own homemade magnesium chloride spray as a way to get magnesium into the system. And obviously you can use supplements, but the big challenge is that we might even try and eat organic food, but if we don't know what that food was, the quality of the soil that was grown in, we still may not get the minerals, even though comes from an organic farm, right? So I think that getting the trace minerals, don't be afraid of getting salts into the system, especially when it's natural salts. So my 3 would be salts, extra magnesium, and getting those broccoli sprouts in, along with what both of you said. So I think we've kind of covered the gamut here. I think we did a good job kind of getting through this. Yeah. So Dr. Kelly, can you just tell us what you have coming up? What's your future holds? I know you speak and lecture quite a bit. So where if people want to hear you or hear about you, or if there's physicians listening that want to learn more about what you're doing, where can they find more about you?
Sure. So you can go to www.drkellybeatlime.com. So DRKELLY beatlime.com. I have all the teaching that I have coming up. My entire schedule is on there. I also have papers that I've written, such as on, I don't know if you guys have covered mTOR, autophagy, probably have, and papers where you can go and print it off and it'll tell you, how to ease up on that mTOR and what autophagy is. Just really simple things that people can go. So I like to put resources on there for patients. You can schedule an appointment with me on that website. And then Dr. Eric and I are going to be teaching in Austin, October 5th, 6th, and 7th, I believe. We're going to be talking about phase 2.5. We're going to take 2.5 days to really talk about this and bile physiology. It's for practitioners, so we can get the word out and be able to help more people together.
Awesome. Dr. Erica, any major plans for you coming up?
No, just chugging along in our practice. I mean, things are going really, really well. And so it's one of those things that we're just, we're trying to help as many people as we possibly can. And we're just going from there. And
so if you want to reach out to Dr. Erica, they can find you at?
brainandbodyhealthcenter.com. And then you can also find us on Facebook, Instagram, and YouTube.
Great. And we, as always, my office is chronic-condition-recovery-center.com. You can see me at Thyroid Answers. Podcast.com I think we have some of our information there. I have thyroid videos I got tons of thyroid videos on YouTube and Vimeo with thyroidproblemsdoctor.com as well. We are actually rebranding our office. So we are taking our regenerative medicine, our stem cell kind of regenerative practice, kind of blending that with our functional medicine practice. So probably by the beginning of August, I will be telling people that our new office is called Rejuvigen, and that's the combination of the two. So focusing on functional and regenerative medicine, the combination of those two things. So we're seeing some really nice benefits. And as I know you are, Erica, with the addition of human umbilical cord stem cell therapy, seeing some really amazing results in our patients with chronic joint conditions, neuropathies, and immune and autoimmune conditions. And I know, Kelly, you and your husband are considering kind of getting into that field as well, right?
Yeah, we're getting the wheels are in motion here on starting our clinic. So we already have a name, we just need a location. So we have the staff. So we're just, we just moved here 3 weeks ago. So all the boxes are unpacked at this point. So we'll see. We're excited about that though. A lot of really great healing stories with stem cells. We're really excited.
Yeah. So
and just with our history of Lyme, I've seen some amazing things with patients who have really struggled to kind of break that vicious cycle with Lyme, that is enough to kind of break it and then work on some of those foundational things. Because it can be hard to work on the foundations when you're that sick sometimes.
Sure. Mm-hmm.
Yeah. And Dr. Kelly and I talked about that offline a little bit, and that is that, you know, there's some foundational concepts, but sometimes these people are really, really sick and you need some boost to kind of put out the fire. Then that's what Erica, Dr. Erica, you and I have talked about that before. The stem cells can really come in and be a huge benefit to calm the fire. So if there's, you know, if you can calm the fire, then you can get to look at, okay, where's the problem really coming from? Which room did the fire start in, right? But if the whole house is on fire, you don't even know where to start. The first thing you gotta do is help calm that fire. And so the stem cells is what I'm seeing, and I'm sure what you're seeing, Erica, is that they just kind of calm the whole thing down. And we just had a gentleman, 420 pounds, 2 bad knees, 2 bad ankles, 2 bad hips, diagnosed with fibromyalgia, chronic arthritis, diabetes. I mean, it's a sad, sad thing. And nobody would do surgery on him for his knees because he was so unhealthy. And they kept saying, you know, you need to exercise more and eat less. And we did, you know, stem cells in each knee. And then we did a 2 cc infusion. And 6 weeks later, he's like, 80% of my pain's gone in 6 weeks. So he did follow a good anti-inflammatory diet. We gave him some general guidelines, got him some magnesium along with the, and some salt. You know, we did some of the basic, real foundational stuff, but the stem cells gave us the kind of the fire, calm that cascade of fire where he's like, oh my gosh, I'm feeling so much better. He lost 20 pounds by just reducing that massive inflammatory response. And now he's motivated and feels better. And now we can get him headed in the right direction so that he doesn't need to be on all these medications. And so we're really seeing some amazing and neat things. So I can't wait for you to get involved, Dr. Kelly, so that we can have another podcast and talk about all the cool stuff we're seeing with stem cells. Dr. Erica and I are definitely going to do a podcast in the next month or so on stem cell therapy and what we're seeing. So I'm going to let you guys go. I got to run to the beach before my wife doesn't talk to me anymore.
You're going to leave without you.
She already left.
Oh.
She's gone. They left. I said, I had a meeting with Dr. Kelly, then we're doing the podcast, and then I said, I will be there. I'm on my way. So I'm going to sign off. Thank Dr. Kelly. Thank you so much for coming on.
Thank you guys so much.
It was great.
And I'll see you guys along the way. All right. Take care. Anybody who's listening to the podcast, tell your friends, share it with people, go to iTunes, put a comment there and let us know what you think about the podcast. Give us a nice review if it makes sense. And if you have any questions about anything you've heard on the podcast, put your questions below wherever you watch it or listen to it, and we'll be sure to get back to you. So that's it for today. Take care, everybody. Yeah. All right. Have a great day, ladies. Okay.
You too. Have fun.
Thanks.